Hi there, my name is Desiree Sizemore and I'm a civically engaged scholar. Unfortunately, work didn't approve my time off request, so I'm going to have to give you my presentation in a video format, but I hope you'll still enjoy it. Today you're going to be learning about healthcare, which is something that I'm super passionate about. We're going to be talking specifically about healthcare in Utah, because, well, that's where we live. This is the community that we all interact with every single day, and it's got some good things, it's got some bad things, and it's got some things that are just like everything else in life. Today I'm going to go over some of those things. I'm going to go over a really cool community partner that I've had the pleasure of working with all of this year. I'm going to discuss a series that I led called the Slice Social Change Series, Health Dialogues, which is a very long title, I know, but it was super cool and you'll enjoy hearing about it, I'm sure. And then I'll end with some of the solutions that I think that both the government and we as individuals can do in order to improve our society. Thank you for watching my presentation, and I hope you enjoy.
Okay, so let's talk about some of the research I've done. I'm particularly interested in lack of healthcare access, and so we're going to talk about some of those people who are most affected, and then we're going to go into what Utah's doing right and what Utah's not doing so right. So for who's affected, I think it goes without saying that the homeless face a disproportionate amount of lack of healthcare access than the rest of the population. 55% of this population has no medical insurance at all. And so that leaves a majority of them without it. And then those who do don't have the best health insurance in the world because health insurance is expensive, even if you do qualify for Medicaid sometimes. Because this population doesn't have access to health care, they're 4 times more likely to die of premature causes that could have been treated, like an infected wound. If somebody is living on the streets and they step on a rusty nail and it costs $80 for them to make a deposit just to see a doctor at urgent care, they're probably going to save that $80 if they even have it and use it to feed themselves and their family instead of going to urgent care. And so if that infection spreads, it can kill them, and this happens with plenty of other things as well. The other population that's really important to talk about in Utah in particular is the LGBTQ population. So the really religious culture here creates an environment that makes it really uncomfortable for LGBTQ folks. Utah doesn't have a lot of data on these folks and about the discrimination they face, but I know that from personal experience, I've had friends who identify with this population and then their parents end up disowning them. And when you're 17 or 18 years old and you're out on your own or out on the streets and your parents kicked you off your health insurance, it's really hard to focus on healthcare. And besides, the healthcare system is so hard to navigate as it is. It's so hard to apply for health insurance. It's so hard to pay for it. And it's so expensive that this population, when they face these issues, end up getting really negatively affected by it. So what is Utah doing right? Utah actually has some of the lowest costs in the country in terms of healthcare. So part of this is because we have a lot of doctors, and part of this is because of our research hospital, but they also believe that part of it is because doctors tend to avoid unnecessary treatment, and they tend to encourage preventative care. So they try to encourage getting your immunizations, and they try to encourage coming in before you get super sick. And they also don't give you antibiotics for a virus and stuff like that, which prevents further issues down the road. We're also pretty healthy. Salt Lake City itself is the 6th healthiest city in the country, and they think part of the reason that we're so healthy is because of the mountains, because of all the outdoor activities we can do, and because the culture here tends to lean away from heavy smoking and heavy drinking. And obviously that's not true of everybody, but those are some of the theories they have for why we're so healthy. Now, what can Utah work on? So our free clinics that we do have quite a few barriers. I can only name 2, and I know that they're both nonprofits, and I would imagine most free clinics are nonprofits. And what do people need when they work for a nonprofit? They need money. They also need volunteers. So when a free clinic is lacking money and they're lacking volunteers, then they can't provide the health care that they need for their patients. So patients aren't getting the health care because these programs aren't being encouraged and people don't know enough about them to help out. Teen sex is also really high in Utah. You may or may not know this, but abstinence-only education doesn't actually work. And while teen pregnancies are declining significantly, the STI rates are rising. We need to teach kids how to be safe and how to have sex safely. Suicide rates in Utah are also quite high. It's especially high in the youth population of around the ages from 10 to 17, so adolescents. Our suicide rates are actually 60% higher than the national average, and that could be due to some of the things that we've discussed, and it could be due to more things. But I think that it's definitely worth keeping in mind that it's something Utah needs to work on, is how to help kids who are depressed and who are feeling suicidal. So now I want to talk about the Malihe Free Clinic briefly. The Malihe Free Clinic is a clinic that offers health insurance for free to people who don't have health insurance. Or sorry, they offer health care to people without health insurance. And so the clinic does a lot of really cool stuff, and I've had the pleasure of being a part of various aspects of what they do since about October. I go there every Friday from 8:30 a.m. to 12:30 p.m. So the top picture is a picture of their new location. They just moved here in, I believe, September, and it's really big and it feels just like a regular doctor's office. So for people who don't have health insurance, they don't have to feel like they're going to some grungy place that maybe isn't the safest. They feel like they're going to a place that is worthy of their time and what little money they may have to pay should they get referred out. Everything that Malihe does in the clinic is completely free to the patient, so obviously they rely on a lot of donations. However, there are some things that patients may have to pay for. You know, if they need to get a mammogram, they have to be referred out, but they can refer them out at lower costs. And for people who have really high paying medications and things that cost thousands of dollars a month to pay for, we also have a medication assistance program that can help those people as well. So Malihe Free Clinic is doing a lot of really good things, and I thought it was really important to mention here because they've really contributed to easing the burden on people without health insurance, in my opinion. So now I'll talk about my social change series. It's the really long thing that I was talking about in the beginning. This is something me and a partner worked on together to open up a dialogue about healthcare and equity in Salt Lake City, and particularly on the community college campus. So the first day we watched a documentary about an undocumented immigrant who is having trouble getting access to healthcare because they don't qualify for health insurance in America if they're not documented. While watching that documentary, we had an opportunity for people to volunteer to make safe sex kits and hygiene kits that we then took back to Planned Parenthood and the Road Home, which, if you don't know what the Road Home is, it is a homeless shelter in Salt Lake City. On the next day, we did a healthcare access panel, and so we had representatives from Planned Parenthood, Utah AIDS Foundation, which is an organization that provides free HIV testing and counseling for people who test positive, and the Hospice for the Homeless in Utah called the In-Between. And they just talked about the barriers that people face in Utah, and they talked about what their organizations do and what they think could continue to be done. On the last day, we had an overarching health access day where we brought Utah AIDS Foundation back to do testing, and we brought Friends for Sight in, which is an organization that does free eye testing, to do those testings for us. We also offered the opportunity for people to learn about more information if they wanted it, because as community college students, a lot of us may struggle with getting health care. So the last thing I want to touch on is just some solutions. I'll go briefly over some government ones and then, more importantly, what you can do to help. So for government solutions, I personally believe that universal health care would be excellent. And so it may be expensive, but we're already paying so much in America for universal health care as it is that it didn't seem like a really big jump. Also, we could expand Medicare and Medicaid programs. We did try to do this recently in Utah, but it got shut down by our government. Hopefully, though, we can figure something out and we can make it easier for people to get health care, not harder. Raising the minimum wage would also be really helpful, simply because cost of living is so expensive. When you're paying $1,500 a month for a studio and you only make $3,000 a month, it's really hard to make rent work, plus utilities, plus all your other bills that you have to do. So what can you do as an individual to help with this issue? Well, to start, you can get involved. You can volunteer. You can call your politicians about any of these issues and tell them what you think should be done. And you can let other people know what needs to be done as well. You can help out your LGBT plus friends and let them know that you support them and you are willing to do anything you can to help them. And the last thing that we can do is educate people. It's really hard to do something about a problem when you don't even know it exists. So letting people know what's going on and what they can do to help can really, really help change our world. Thanks for watching my presentation, and I hope you're coming out learning more. Have a great night.